From Studio 8A, coverage you can count on in high definition. This is KOMU 8 News Today.
Hello, and welcome to the 2012 edition of the Missouri Urban Journalism Workshop. I'm Kenneth Harris. This year's theme is health. The Affordable Care Act continues to be a controversial issue even after the recent Supreme Court decision. Lucy Fulliton from Germantown High School in Germantown, Tennessee, tells us just how much some Mid-Missourians know about the ACA.
It's a simple day at the beach. Belandria Robinson and her 4 children are enjoying some relief from the heat. But Robinson cannot forget all her problems.
With the job that I have, benefits and health care is not available to me.
Her 4 children are currently covered by Medicaid. However,
I'm not covered. So if I ever have to go to the hospital, I have to come out of pocket for it.
But Robinson, like so many Americans, did not know that she is required by the Affordable Care Act to get coverage by 2014.
Is that the thing Obama's working on?
That I know very little about. There are parts of it that I still don't understand.
Stan Hudson is the Associate Director at the Center for Health Policy, and he says he spent months reading the ACA.
The idea is that, with health insurance, the way it works is, you create insurance pools, and the more people you have in that pool, the more healthy people you're going to have who can then pay in. That will cover some of the sick people.
But even at this beach, Robinson is not the only one without health care.
With the bills that I have, I really can't afford the insurance that they're offering.
Jeremy Hurd works in Columbia and says that he doesn't think it's fair to fine him for not having insurance.
It's kind of a scary thought to think of having some sort of a medical emergency or something like that, when it's out-of-pocket expense, because it really hurts a guy, in my tax bracket.
Yeah, information about it would be helpful.
The more that are insured, technically, the better we'll be, because our healthcare costs won't be as impacted by that. Because when you're uninsured and you can't pay for the cost, then society ends up paying for that.
And accurate information, Hudson says, is hard to find in this political climate.
There's not a lot of open and encouraged debate about the issues.
And that is because many of these issues have not been solved at the federal level.
When the details of the changes are ironed out, then there will be education at the federal, state, local level.
I think you've really got to approach it just one issue at a time.
Educating the public about healthcare resources that are available to them is very much a public health issue, because we want to make sure that people have access to health care.
But until then, people like Robinson will have to rely on a different type of support.
I just pray that nothing ever happens to me, that, ever get hospitalized or sick to where, I'd have medical bills that I have to take care of, because, there's just no way I'd be able to do it.
A simple wish about a complex issue. With the Missouri Urban Journalism Workshop, I'm Lucy Fulliton.